Hello, my name is Annabeth Benucci. Today is March 17th, and I'm going to be giving a quick overview of Graves' disease. Graves' disease is ultimately an autoimmune condition, and it is one of the most common causes of hyperthyroidism. So, with hyperthyroidism, we're having an overproduction of the two main hormones that the thyroid produces, that being T3 and T4. So with Graves' disease, the body is producing an antibody out of an autoimmune response that the thyroid is mistaking for thyroid stimulating hormone. This hormone is going to cause the thyroid to produce way too much of T3 and T4. So we can think of this overproduction of T3 and T4 as a way in which the body is kind of going into this metabolic overdrive. So a lot of the symptoms that are going to come up with Graves' disease are along that line of metabolic overdrive. So anxiety, irritability, weight loss, GI distress in the form of diarrhea, and then also sensitivity to heat. Another very characteristic sign of this condition is exophthalmos, which is the bulging of the eyes. It can lead to this kind of chronically surprised facial expression, and it's going to look as if the eyes are way too open or way too wide chronically. And then it can also have a feeling of grittiness and pain for the patient. We might also see an enlarged thyroid or a goiter. So along with those symptoms, if you go to an endocrinologist, the tests that they might run to see if you have Graves' disease would, of course, be a blood test to evaluate perhaps the level of T3 and T4, as well as TSH, or the thyroid stimulating hormone, TSH, in your body, in your bloodstream. Some other options might be a Doppler ultrasound of your thyroid or a radioactive scan of your thyroid with radioactive iodine. So those are some ways that Graves' disease might be diagnosed by an endocrinologist. If a person does have Graves' disease, some of the treatment options might be beta blockers, as well as anti-thyroid medication. And then a surgical option might be a complete thyroidectomy to have the thyroid removed. Graves' disease, unfortunately, does not have a cure. It is a decently manageable condition to have. It is much more common in women as well as people under the age of 40. It's a condition in which mild cases might experience going into remission, but it is something that might come up again later in life. So definitely something that requires chronic management. Another thing to be aware of might be something called thyroid storm, which is a life-threatening condition that requires urgent medical care that can come up in rare cases with uncontrolled hyperthyroidism. So that's something to keep in mind about Graves' disease. Again, this condition is an autoimmune disease, and with many autoimmune diseases, we don't have a great understanding of what's causing the body to go into that autoimmune response, and that's true of Graves' disease as well. So there's no cure, and that root cause is not well understood. So definitely an area for further research in the future. But fortunately, it is a decently manageable and treatable disease, as well as a somewhat clearly defined disease to be diagnosed. So that is my quick overview of Graves' disease and hyperthyroidism. Thank you.